What's up, everyone? Today we're going to be talking about Kybella, everything you want to know from price to figuring out whether it's worth it or learning if it's the right treatment for you. We can stop, and I can tell you right now, Kybella sucks. Stay away from it. I'm a surgeon. I know how to use Kybella. In fact, I can teach you how to use Kybella. That does not mean it is a great option for you. So let's get started first with the basics. What is Kybella? Kybella is a drug called deoxycholic acid that has been around for decades. In 2014, a massive drug company called Allergan did a study on 30,000 patients where they injected into people and basically got it FDA approved since it had been used off-label, and they started selling it to everyone, saying it's a wonder drug that without surgery will melt fat. Except when they're doing an FDA approval, you forget to mention two really important things that you care about. The first is how much does it cost, and the second is how painful is it. So how much does it cost versus liposuction? I decided to call the company in 2017 and ask them, can you tell me how much you injected into each patient? And we also asked a whole bunch of doctors how much they're charging on average and how much the product costs, and we came up with a brief analysis. So here is the tea. The first thing, they use $6,800 worth of Kybella in each patient. No shit, it works. You're using $6,800 worth. Why do patients put up with that? Because they were being paid to be part of the study. You aren't being paid. You should not be paying for pain, risk, and being paying out of your pockets for something that is just simply not worth it. Now, when it comes down to it, they injected $6,800 worth. The average surgeon doesn't inject that much, but we cannot tell you how much worth you need. It's a wild guess that we're making based on how much surface area you have in this area directly under your chin and based upon what it is that your goals are. In the end of the day, I can't tell you precisely how much fat is going to be melted by the Kybella because the Kybella decides that. You don't decide that, neither does the injector. You simply inject in there, cross your fingers, hope for the best. The second part, how is it compared to surgery? It is more painful. You will swell more. You will bruise more. You have more risks of nerve injury. You have to repeat it multiple times. Find people who have had Kybella and tell you they had a great experience. When you go to the big plastic surgery website called RealSelf, the lowest worth it rating of any procedure, period, is Kybella. Now here is the tea you need to hear. Why is Kybella so popular? Why is it an option? Number one, it comes from a giant drug company who won't even work with me because I give videos like this to tell you guys the truth. But that giant drug company spends a lot of money telling you how amazing it is. The second reason, if you are not a surgeon or you do not own an expensive machine like Cool Sculpting, that's what you can sell to people. It requires a small investment, and your nurse injectors can all of a sudden now get into the fat contouring space. That does not mean is the best option for you. You want the advice of what you should do from someone who understands all the options and can tell you about all the options. Anybody being honest with you, anybody telling you the truth will tell you that Kybella should never be used under the chin and should never be used as a better alternative to any of the things out there. Because even afterwards, when Kybella doesn't work like you wanted it to work, and you go to see a surgeon like myself, I will tell you, you have scarring, it's gonna be a tougher surgery, I count that as a revision, and you will be paying more. Kybella should be stayed away from. Now, the last thing I wanted to talk to you guys about is when is it okay to use Kybella? The truth, not very often. When it's cheap or free, which you are gonna have a tough time finding that, or when you're particularly doing it on stubborn areas like your love handles or bra fat areas. In those areas, I think it works really well. Not FDA approved, but please don't use it in your cheeks or your eyelids because it's just not safe. 4% of people in the study had temporary nerve injury. Also, Kybella doesn't treat your jawline, nor does it tighten your skin. It is something that all along the way, there's much better alternatives to, and the doctors who do it are simply scaring you out of surgery because they don't know how to do the surgery. Bottom line, stay away from Kybella.